Priyanka Srinivasan presenting you your messy minds. In this video, we are going to see what are the different types of therapies which we actually give to the middle childhood, that is from 6 years to 12 years of kids. Before we move on to the video, I just want you all to think about what could be the proper or desired treatment that you all would take if you are stressed or depressed. So you might have some ideas, right? Listening to songs or something like that. So what is your method of treatment when you are depressed or stressed? So we'll move on to the content. So let's talk about different therapies now. First we'll discuss about the individual therapy. So by the word itself, I think you all would have got an idea, which is individual, which means the therapist actually deals with the people who have the mental distress or mental emotional problems or disturbances individually. That is, if it's in a room, then it's only going to be your therapist and yourselves when you are there in that room. So you can actually talk to them about all your problems with them. So that is all about this individual therapy, which happens ultimately, which is for one-to-one conversation. And next one is the family therapy. Unlike the individual therapy, here the therapist actually calls the whole family members. So all of them will be called at the same time. This is because they will actually see what are the family influences that is actually affecting a person in the family, and in what all ways could others actually have a probable kind of disturbances that could be caused to the individual. So for that we actually need the whole family members, right? So the therapist actually talks to all the family members in one single room. So that is how the family therapy goes on. And the next therapy is behavioral therapy. So in this therapy, the therapist actually tries to apply all the theoretical therapies that they have learned, and they try to actually kind of encourage the desired behaviors and eliminate the undesired ones. So for example, let's say the childs who are finger licking, no? So for them the undesired behavior is licking the finger. So the desired behavior is not licking the finger. So they can actually give some kind of therapies and they will actually eliminate this finger licking habit from the child. So that is how behavior therapy works like. And the next therapy is art therapy. So according to this therapy, the therapist actually allows the person who has some kind of mental disturbances to express their emotions in a way of art material or kind of in the media, rather than just explaining it through the words, unlike the other therapies. So one kind of art therapy could be creative movement therapy. So according to this therapy, the therapist actually allows the people who have some kind of mental disturbances to express their emotions through their body movements. So they actually ask them to move their body and express out their feelings. And therapy is also given in the same manner. So if for example the people are so much aggressive, okay, so then they will just move their body so vigorously and all that. And if in case they are going to have some kind of peace in them or some subtleness in their feeling, and then they will be moving their body elegantly, very smooth and slow like this. So that is how the art therapy works like. And the next therapy is play therapy. So if you see, play therapy is especially made for the kids. Okay, why? Because we always attribute playing with the kids and kids with the plays, right? So in the same way, play therapy is especially made for the kids alone. So in this therapy, the therapist actually allows the kid to play some kind of games where they can actually cope up with their mental issues in them. So the kids will also enjoy what they are doing it, right? So it will actually help them grow up in their mental status. So that is how this play therapy works like. And the last therapy is drug therapy. So ultimately, when nothing of the other therapies are going to work, then we actually lead to the drug therapy. But in most of the cases, we can say like ultimately the only solution can be the drug therapy. And when I say drug therapy, it is not something very new to all of us, right? Because we all take the medications in our day-to-day lives too. Like we can say if you are falling sick and then you suddenly take the paracetamol, right? So it is like very common for us. And for the mental disorders and mental issues also, there are a few kinds of drugs like this, like medications like this. And the same thing will be administered to the patients, like mental patients who have some kind of disturbances. And there we come to the end of this video, and I hope that you all would have got your favorite therapies to follow up. And if you all have any doubts, you can always put it on the comment box and I'll be there to help you out. So with the next content, I'll meet you all in the next video. Until then, it's bye from Priyanka. Bye!